Welcome to my presentation. This is a development and feasibility study of MR multitasking-based dynamic imaging for a cerebrovascular evaluation technique, also called MT-DICE. Dynamic susceptibility contrast MRI is commonly used for assessment of cerebrovascular perfusion hemodynamics in patients with neurological disorders. However, conventional single-echo EPI-based DSC-MRI often suffers from measurement errors due to contrast agent extravasation in cases of blood-brain barrier breakdown, which will lead to both T1 and T2 star leakage effects. It has been shown that multi-echo-based acquisitions could be used to correct for T1 shortening effect, but the T2 star leakage effect still violates the central volume principle and thus lead to quantification errors regarding to the perfusion matrices. In the meantime, dynamic contrast enhanced MRI is most widely used imaging method for assessing cerebrovascular permeability, and the permeability information can be applied to correct for CA leakage effects in DSC-MRI. Therefore, simultaneous evaluation of leakage-insensitive perfusion and vascular permeability parameters is often clinically desired for better rate stratification and prognosis. However, the hypothetical workflow for simultaneous perfusion and permeability quantification is impractical due to a lengthy protocol, interplay between two contrast injections, and overdose of contrast agent. Therefore, a better workflow would be to acquire both DCE and leakage-corrected DSC parameters within a single scan using a single dose of contrast agent. So in this work, we propose an MR multitasking-based dynamic imaging for cerebrovascular evaluation technique that provides DCE and leakage-corrected DSC-MRI information simultaneously with one 7-minute scan and injection of a single dose of contrast agent. MT-DICE employs a 3D Cartesian acquisition with non-selective saturation recovery preparation followed by multi-echo flash readouts. Auxiliary data is interleaved with the imaging data every fourth readout and is collected at a case-based center. Phase and partition encoding for the imaging data are randomized with a variable density Gaussian sampling pattern with the highest sampling density in the center of case-base. Our reconstruction is based on MR Multitasking Framework. Specifically, our 6-dimensional image model contains 3 spatial dimensions for 3D imaging and 3 temporal dimensions, namely the saturation recovery dimension, echo time dimension, and contrast enhancement dimension, respectively. The correlation between brain images along different time dimensions make it a low-rank tensor and can be therefore partially separated as UR times phi. Here, phi contains the temporal basis functions and is estimated from the high temporal resolution auxiliary data, where UR are the spatial coefficients and is recovered by feeding phi to the acquired imaging data D. After the image reconstruction, dynamic T1 and T2 star quantification were conducted based on block equation and corresponding sequence structure. T1 and T2 star based contrast concentration curves are directly calculated from the dynamic T1 and T2 star values, respectively. DCE-MRI permeability matrices, including VP, K-trans, and VE, are then derived from the T1 based concentration curves using the extended TOFS model. Conventional non-corrected DSC-MRI parameters, for example CBV and CBF, are calculated directly based on the central volume principle. Leakage correction is based on combined biophysical and pharmacokinetic method, which exploits the expressions here to perform leakage correction for the DSC-MRI matrices with the help of the derived permeability parameters. To test the feasibility of our technique, 5 healthy subjects and 1 patient with meningioma were scanned on a 3T MRI system VIDA with a 20-channel head-neck coil. Major imaging parameters of MT-DICE are listed in the table. Conventional 2D IR-TSC and multi-echo GRE sequences were also acquired to serve as the references for T1 and T2 star quantification. Then followed by the results of dynamic T1 and T2 star fitting. Here shows some example pre- and post-contrast T1 and T2 star maps acquired by MT-DICE and reference mapping sequences with matched protocols. Statistical analysis demonstrates good agreement between MT-DICE and corresponding reference sequences. Next is the perfusion and permeability quantification results from the 58-year-old male patient with meningioma. The boundary of the tumor can be clearly depicted on dark fluid T1 and T2 TSE images acquired during clinical evaluation. The permeability maps, including VP, K-trans, and VE, and conventional uncorrected perfusion parameters, including CBV and CBF, are also shown here. The leakage-corrected DSC-MRI maps were derived by using the permeability parameters as we discussed in a previous slide. In conclusion, in this work, we developed a technique called MT-DICE, which can do DCE and leakage-corrected DSC-MRI simultaneously within a single scan using a single dose of contrast agent injection. The way we derive perfusion and permeability parameters is based on T1 and T2 star mapping, which we assume will be more accurate compared with conventional signal intensity-based methods. Also, our technique can achieve a 1-second temporal resolution without compromise in spatial resolution. Moreover, our sequence is a flash-based sequence rather than EPI-based, so it does not suffer from the distortion artifacts. Our future direction includes further conducting clinical validations of this technique in different types of cerebrovascular diseases. That's all. Thank you.